Thyroid Self-test. The kit includes a test cassette, instructions for use, plaster, alcohol wipe, lancet, buffer solution and capillary dropper. Not included but required is a timer. First, wash your hands with soap and water. To remove the protective cap of the lancet, carefully twist it 360 degrees without pulling it. Use the alcohol wipe to clean the fingertip that will be pricked with the lancet. The side of the ring finger is recommended. Allow to dry and encourage blood flow to your fingertips. Press the lancet down firmly against the side of the fingertip. The lancet will retract automatically after use. Keeping your hand pointing downward, massage from wrist to fingertip to obtain the blood sample. Without squeezing the dropper head, touch the tip of the capillary tube to the blood sample and the blood will automatically enter the tube through capillary action. Make sure you collect enough blood to reach the fill line and take care to avoid air bubbles. If more blood is required, you may need to massage your finger again and apply a plaster if necessary. Gently squeeze the dropper to apply 2 drops of the blood sample into the sample well. Unscrew the cap of the buffer solution and add 2 drops of the solution into the sample well. Start the timer. Wait for 10 minutes before reading the results. Do not interpret the results after 20 minutes. If the results are negative but symptoms persist or you yield a positive result, then we advise you to consult your GP.